medications that affect fertility in men. Hello, I'm Dr. Kady. Welcome here to Heydoc. On this channel, I talk about women's health, fertility medicine, and pregnancy-related issues. I'm a board-certified family doctor. If this type of content tickles your fancy, be sure to subscribe. It's almost impossible for us to talk about fertility issues without looking at male-related factors. This video is crucial because many are the men who are actively trying to start a family without being aware that there is a drug that they are taking or a few drugs that they may be taking at the same time that is affecting their sperm count or even the quality of their sperm. So this video is purpose for all men and their women to go through the list that I'm about to talk about and see if you are on any of these drugs. Remember, if you are, don't just stop these. Discuss it with your own doctors because some medications cannot be stopped abruptly. Diving right into talking about these drugs, the first drug class we're going to address are the anabolic steroids. As many will know, these drugs are purposed to enhance the performance of athletics and for men who are keen bodybuilders, so they want bigger muscle bulks. The effect of these drugs on fertility is that they cause the testicles to shrink, and this has a knock-on effect on the production of sperm cells because shrunken testicles lead to lower testosterone levels. And remember, you must have a good testosterone level in order to produce a good number of healthy sperm cells. And the reason why it's important for you to be aware that anabolic steroids can lead to infertility is because any man that has used anabolic steroids for a long period of time, in other words, they've been on it long term, it can lead to an irreversible low sperm count. Talking of low sperm count, I've done a video on this channel that looks at the semen analysis, what the different parameters mean, and whether or not a low sperm count can be reversed. It is well worth a watch. Next on the list are different chemotherapy drugs. Chemotherapy drugs are very often used to treat cancer, and that can be cancer of any part of the body. Many chemotherapy drugs, particularly the alkylating agents like cyclophosphamide and cisplastins, these chemotherapy drugs damage the sperm producing cells in the testicles, leading to either temporary or permanent infertility. Of course, it will depend on various factors like the length of the treatment course, the dose of the drug, whether the chemotherapy was combined with radiotherapy. So whether or not chemotherapy will cause permanent or temporary infertility will depend on all of these factors. That said, if you are a man who is in your reproductive years, either a young man who hasn't started a family, or even if you have had a family, you are still wanting to have more children and you get given the unfortunate diagnosis of cancer, the doctor should have that conversation with you about storing your sperm cells. It will be like the egg freeze that women do. You should be given that option if you still wish to have a family. Depending on what part of the world you are in, some health authorities will fund that, particularly if the patient is of a younger age group, they've not started their families, or other factors will be taken into account. Some health authorities will pay for you to be able to store your sperm cells if you've been diagnosed with cancer and you're needing chemotherapy. Or if you are on the other end of the spectrum, you've already got children, but you want to have more children. Often you will be required to fund this procedure yourself. Opioid medications. In this class of drug, we have morphine, oxycodone, fentanyl, several of these highly dependent and highly addictive painkillers. The long-term use of these opioid medication affect the Leydig cells. And these are the cells that are found in the testicles that are responsible for the production of the testosterone hormone. This then goes on to impair sperm cell production, leading to low sperm count. But in addition to causing low sperm count, continuous and long-term use of opioid medication leads to impaired sexual function in men, otherwise known as erectile dysfunction. Testosterone replacement therapy. Now, one thing that you have to know about testosterone replacement therapy, although it's a very useful drug when it's given to men who have a significantly low level of testosterone and they are finding themselves with erectile dysfunction, it does impact your fertility. Before I talk about how it affects fertility, let me highlight that it's not a bad idea to have testosterone replacement therapy if your testosterone level is low, particularly if you are finding that you are always needing drugs like Viagra or tadalafils, which are medications that are important and help men to have an erection when their sexual function is impaired. But what the drugs of this class do is that they suppress the body's own ability to produce testosterone by itself. And it does that because it disrupts the body's normal hormonal feedback loop. And remember, this feedback loop is absolutely crucial for the body to produce its own testosterone, which will lead to the production of sperm cells. So I've come across a lot of patients, particularly in their late 20s, in their 30s, who felt like they were doing the right thing by receiving testosterone injections with a few months interval. But like all the other drugs that I've described, testosterone replacement therapy can lead to a low sperm count, and at the extreme end of things, your testicles stop producing any form of sperm cells, and that condition is known as azoospermia. Sulfasalazines. This drug is usually used in inflammatory conditions like Crohn's or rheumatoid arthritis. But what many do not know about this drug is that it lowers the sperm count, in addition to significantly affecting the motility of any sperm cells that are produced. Thankfully, though, the effect of sulfasalazines are reversible once the drug is stopped. Another drug that affects fertility in much the same way as the sulfasalazines are the calcium channel blockers. These drugs are used to manage high blood pressure and at times a condition known as Raynaud's syndrome. Examples of drugs in this class include nifedipine, amlodipine, and verapamil. The drug that most men are shocked can lead to infertility are the alpha reductase inhibitors. In men of the older age group, they are used to reduce the size of the prostate, resulting from a condition known as benign prostatic hypertrophy. But the same drug, being finasteride, being used at a lower dose, is used in male baldness. Now, as you know, many men, even from their late 20s to their 30s, start to lose hair. And that is very bothersome for some of them. And so many have been on finasteride 1 milligram for a long period of time. It has not only prevented further hair loss, but for some, it has stimulated hair growth. So many men have continued to use this drug year after year after year, some even decades. The drug works by blocking the conversion of testosterone to dihydrotestosterone, and this hormone is absolutely crucial for normal sperm cell development. Another drug of this class is known as dutasteride. Next on the list, we have anti-epileptic medications, would you believe? So the valproate and carbamazepine. These reduce sperm count, sperm quality, and the motility of the sperm cells. Antipsychotic medications that are used to manage conditions like schizophrenia or bipolar disorders are culprits for causing infertility in men. The drugs that belong to this class include risperidone and haloperidol. These drugs increase the prolactin levels, and high levels of prolactin has a knock-on effect on the negative feedback loop, leading to a reduced production of the testosterone hormone, thereby causing reduced sperm cell production. Some anti-ulcer medications like cimetidine and ranitidine will affect the hormonal balance, leading to low sperm count and poor sperm cell mobility. The immunosuppressant known as cyclosporin, which is used to prevent the body from rejecting a transplanted organ, can also affect fertility. But usually what tends to happen is that when cyclosporin is stopped, the sperm count returns to normal. Non-steroidal anti-inflammatories, would you believe, more commonly known as Nurofen or ibuprofen. The long-term use of these for conditions like rheumatoid arthritis or any other inflammatory conditions that may benefit from these non-steroidal anti-inflammatories will lead to infertility by suppressing testosterone production, leading to an overall hormonal imbalance. But thankfully, the low sperm count that results from long-term use of non-steroidal anti-inflammatory usually is reversible. Blood pressure medications like the beta blockers, for example, atenolol, and the thiazide diuretics like benzofurothiazide. Long-term use of these drugs leads to erectile dysfunction and inevitably a low sperm count. Thankfully, also with these drug classes, it is reversible. So stopping these drugs after 3 months, you should start to see your sperm count come back to normal. But if you don't know that these drugs affect your fertility, especially because controlling your blood pressure is so important and it prevents other pathologies from developing, you will continue to take these drugs whilst making a futile attempt at falling pregnant. Recreational drug use also affects fertility in men, and this is how the different types of recreational drugs affect fertility in men. That is it for this video. I hope you've enjoyed it and that it has been informative. Remember, if you are on these medications and you are considering stopping them, knowing what you know now, it's important that you don't do it on your own back, that you take the information back to your doctor, discuss what can be done, and then be guided by your own doctor. I'm a doctor on YouTube. I love what I do, but I'm not your doctor, and your clinical situations will vary. I've enjoyed making this video. As always, please do show us some support by smashing the like button and then go one step further and subscribe. And that really shows us that you enjoy what we do right here on Heydoc and encourages us to create more content for you. In the meantime, remember to share and check out all the other videos that we've got on this channel. Take care, and as always, I'll see you later, and